With extensive expertise in AI and data analytics, Prashant has pioneered projects that leverage behavior data, language cues, and predictive analytics to support timely and effective mental health interventions. His work underscores the potential of AI to contribute to suicide prevention by augmenting human care with data-driven insights, while also addressing the ethical and operational challenges inherent in applying technology to such a sensitive field. So today, the title of his presentation is Leveraging AI for Suicide Prevention, a multifaceted approach to mental health support. All right, with that, Prashant, take it away, please.
Right. Good afternoon, everyone. Thank you for being here today, and thanks, Dr. Fei Fan Liu and the UMass Chan Medical School, the CAPES faculty, and all the organizers for having me here. And thank you for everything you do. Once again, I'm Prashant Ramanam. I'm the Chief Technology Officer at Backpack Healthcare, which is a pediatric and family mental health organization that serves patients through therapy and psychiatry. And we also have a number of AI and machine learning tools to address the mental health crisis. So today I want to talk a little bit about one of the most pressing issues that we face today, which is suicides as part of mental health, and how the thoughtful application of AI can play a transformative role in preventing it. So we'll discuss a few opportunities, challenges, and real-world examples of how AI can help us better monitor and support those at risk early and effectively. And I'll also share some of what we've done at Backpack Healthcare to address this challenge. Right. So let's get started. So mental health is not a singular issue. Right? It's a spectrum of conditions that affect millions of people worldwide. Often in very unique and complex ways. And it's crucial to understand and recognize the diversity of mental health challenges to better understand and diagnose and treat those who are at risk. So obviously, like you see on the slide, it's a wide variety of conditions. It's ranges from common ones like anxiety and depression and ADHD to more complex disorders like schizophrenia, OCD, and psychosis. And these conditions don't just impact emotional well-being, they influence pretty much every aspect, including cognitive, physical, and social health. And what is particularly challenging is that conditions like, let's say, PTSD or dissociative disorders can often go undiagnosed, especially when the individuals face stigma and limited access to care or don't recognize the symptoms themselves. So that makes it even more complicated and challenging. That's where I believe AI can play a critical role by identifying subtle signs and analyzing patterns in behavior and helping clinicians offer more personalized interventions early. So, that's really the core of what I'm going to talk today. But before that, let's take a step back to understand the scale of the issue, right? So it's obviously a huge public health issue in the US, and just to kind of put the whole mental health crisis into perspective, 1 in 5 people are diagnosed with a mental health issue. That's almost 20% of the population, and that's millions of individuals, almost 60 million individuals or so in the US itself, and a lot more globally. But what's more concerning is that many more are undiagnosed, which potentially shadows the number that is diagnosed. So it's a really big problem overall. And what's even more concerning is that 50% of all lifetime mental health illnesses begin by the age of 14, and most of them, at least by 75% of them, start by 24. And that highlights the critical need for early intervention, especially for youth and young adults, because then you change the whole trajectory of their lifetime by making them more productive members of society as opposed to a burden. And finally, talking about burden, the economic burden specifically, the US today spends almost $300 billion annually on mental health care. The number is probably much higher, and this number is from 2021 at the height of the pandemic. And much of it is driven by system failures such as delayed diagnosis or fragmented care and a shortage of mental health providers. So what's driving these challenges, and why is mental health crisis still so pervasive despite the resources being spent, if we spend so much as a country, every state, at every level, why do we still have these challenges? The problem is not just it lies not only in like societal conditions, but also in technological limitations, right? So that's what makes it harder to monitor and support those needs. So let's break down those conditions and see what really causes these. So one of the most important things is stigma, and stigma remains a huge barrier. Nobody wants to talk about it. Parents don't want to talk about it. Children don't want to talk about it. Adults don't want to talk about it. So shame and misconceptions and fear really prevent individuals, especially youth, from seeking help when they need it most. So that is one of the most important reasons, because if you don't know it and if you don't know what it is and there's no vocabulary to explain it, then the treatment is nowhere in the horizon. So that is one of the most important issues. The second key issue is it's a huge shortage. There's a critical shortage of mental health providers, and people are waiting an average of 4 to 6 weeks to get care, which can be catastrophic for someone in crisis. So just to kind of highlight the scale of that, there's probably at least like 60 million people that are diagnosed, maybe many more that are undiagnosed. So it's maybe 100 million number in terms of people who need help. And in terms of number of clinicians or therapists who are available, it's probably less than 500,000. So it's a huge scale. And even if you think that each clinician can see a significant number, 20 to 30 patients at a time, you're still talking about a huge care gap, almost the order of 10x between what help is available and what is required. So that's a huge problem. And third is that the healthcare system is fundamentally broken. So most of our vulnerable populations, like youth or low-income families and rural communities, they're all left behind because of inadequate access in terms of insurance, inadequate insurance coverage, or any kind of systemic barriers to care. And lastly, mental health technology is in the Stone Ages. It hasn't really kept pace with other areas of healthcare, or even like other industries, like areas like finance, or some of those industries are way ahead than healthcare, and especially mental health care. And many clinicians and therapists still rely on outdated tools and methods, leading to inefficient workflows and burnout, and missed opportunities for early intervention. And that combined with the fact that there's only a handful of clinicians compared to the total patient population, that's a huge problem. And the consequences of these failures are devastating, right? So when stigma and shortages and systemic issues prevent people from getting care that they need, then we see outcomes that no one should have to face. So let's take a look at maybe a closer reality of what happens when mental health support fails, right? First, obviously, there's shame and stigma that still prevent individuals from seeking help, even when they desperately need it. So that is still there. And then a shortage of providers, like we talked about, means that there's delay in care, and the delay means that it increases the risk of a crisis. So we already know that 1 in 10 individuals who seriously consider suicide actually go on to attempt it. And for these people, there's then 4 to 6 weeks. A waiting time is obviously disastrous. Then the gaps in care are still there, and they leave those that are with the highest risk with no safety net. And then finally, the outdated tools that we talked about and other tools and technology, they often miss these critical warning signs from various sources, and they basically leave clinicians and patients unsupported. And then basically suicide is the tragic outcome when something like this happens. And actually, after accidents, suicide is the second leading cause of death for ages 10 to 34. That's a huge statistic. It basically means that it causes more deaths than physical disease for those between 10 and 34. And there's a lot of focus on physical health in the country, I mean, rightly so. But there's not enough focus yet on something that is a much bigger problem and causes more deaths in the country. Right. So let's maybe understand what are the factors behind suicide. So there are various factors. The first one are behavioral factors. Behavioral factors like isolation, drastic mood changes, and substance abuse, they can all often be early red flags that signal some kind of emotional or mental health challenge. And then there are psychosocial factors like social pressures or drastic mood changes, traumatic life incidents, and other that can exacerbate someone's risk, whether it's losing a job or breaking up or bullying, etc. Also, there's demographic factors, there's cultural factors, and many other factors that are also involved in that. And then lastly, there are clinical risk factors for individuals coexisting with mental health disorders or a history of prior suicide attempts or chronic physical illness. All of these things put together, their risk profile is significantly heightened. And these are some categories and examples. There are probably many more examples within each category, and likely other categories like environmental factors, like if they have access to weapons at home or their digital or online behavior and so on. So all of those factors together are significant risk factors. And then the data that all of this provides and the ability to capture and analyze the data, that's where the real opportunity lies. By connecting data across all of these dimensions, across behavioral and psychosocial and clinical risk indicators, we can detect patterns that otherwise might go unnoticed if you're looking at just one factor. So when these are analyzed together, they give us a much more of a clearer picture of risk from an individual point of view. So what is the risk of this individual overall, considering all of these factors? And that's really where AI and data analytics really come into play, because that is not easily possible humanly to look at all of the data that's available between unstructured data, structured data, and all the diverse data sources, and analyze that and come to a conclusion on an assessment of the risk for an individual. And that's where I think AI and analytics really come into play. And obviously, as you know, the early warning of indication is really important, and that could really, the sooner you do it, the better your chances of averting it. So with the ability to process like vast amounts of behavioral, clinical, and psychosocial data, AI can really help identify these early signals and predict risks and support timely intervention. So let's look at a little bit of like how AI is transforming that mental health support. And the most important part is the data fundamentally. And the power really lies in the diverse data sources and which really fuel the advanced capabilities and actionable outcomes, which is where it really supersedes what humans are able to do practically with our capabilities. So we know AI thrives on data, and by integrating data from multiple sources like language data, like therapy notes or journals, and there's behavioral data like sleep patterns and social isolation and other physical activity. There are biometric signals like voice tone or facial expressions in certain cases, or data from wearables and other devices. Clinical data from diagnosis from pediatricians or doctors, or psychiatrists or other prior mental health interventions and any kind of medication history. All of these are factors. More importantly, even the engagement data, like for example, if they're using a mental health or a self-care app, what is their app interaction? What is their engagement level? What kind of interactions are they having with the chatbot? And all of those things, those are all clear indications and are really valuable data points that we can leverage. So when we take all of these and then we look at the key capabilities from AI point of view, for tools for action. So we can put all these together, then we can do predictive modeling, which basically helps detect suicide early based on historical real-time data. We can analyze anomalies. We can flag sudden changes in mood, behavior, or other physical indicators, and basically to let us know when something is off and do the right kind of alerting and identification. You also have natural language processing, which is more of a traditional technique, analyzes communications to uncover signs of emotional distress. And then more recently, over the last few years, we've had tremendous strides in generative AI, really. I think that is probably one that has completely changed the game in terms of both analyzing information from diverse sources, as well as also providing more tailored support, like journaling prompts or chatbots, motivational messages, or even escalation guidance. So all of these are possible based on the data type foundations that we have. So we can look at all that data and then look at all the key AI capabilities, and together we then get outcomes like or key functionalities like high-level risk prediction, identifying and scoring individuals for suicide based on multimodal data, and then real-time monitoring for continuous tracking of changes to allow detection of crisis scenarios. So doing it throughout the day, 24/7 by 365, to get data from every single source and be able to do that. So that's possible. We can come up with personalized interventions at the right time. So if somebody's considering something in the middle of the night where they're depressed and they don't have the availability to talk to a clinician or seek help from friends or parents, so you can provide personalized interventions by offering targeted coping mechanisms, and you can empower individuals with the right tools at the right time in a super hyper personalized way, considering all factors involved. So not generic guidance or generic chatbot support, but really super and personalized interventions. And lastly, there are escalation protocols to automate alerts to caregivers or guardians or friends or family members, spouses, etc., or crisis services like 988 when high-risk situations arise. So by combining all of these multimodal data with AI-driven tools, we can really move mental health from being reactive to more proactive, and helping clinicians and caregivers and individuals take action before a crisis occurs. And so I think that's together, when we put all of this, it's really powerful. So now that we've seen kind of like how AI and analytics can transform mental health, I want to maybe look at a hypothetical example to understand how this technology can be applied in practice. Okay. So kind of just bring it back to life with a real world scenario. If you look at an example of a young adult experiencing mental health challenges, often the warning signs are scattered across multiple data sources, like we spoke about, making it hard to detect the risk early. And that's where AI can really step in, bringing these signals together, enabling early identification and driving action. So first, let's look at just along the lines of the previous slide. If you look at the data that paints the picture, the language data, the AI can analyze therapy notes and journals to flag any kind of concerning patterns like increased negative language or such. And then wearables can detect irregular sleep and reduced physical activity. Both are indicators of deteriorating mental health and potential crisis. And then there's biometric data, elevated heart rates, and variability signals that indicate rising stress levels. And in this case, the past records might show a prior suicide attempt, which obviously puts them in a higher risk category, and ongoing treatment for depression, right? And then if they decrease use of a self-care app, or slow or short or infrequent chatbot responses that really reflect disengagement with the app and with the whole process of mental health. So all of these are data points. And then if you look at analyzing this data, you can again do predictive modeling and say that identify the high-risk behavior based on all these combined data streams, and flag any kind of sudden changes such as worsening sleep or rising stress, increased average heartbeat, and so on. And then analyzing troubling patterns in language such as journal entries to reflect that probably reflect like things like hopelessness or a tendency to give up on things or life. And then generative AI can then craft personalized support, motivational prompts, and coping exercises or escalation recommendations based on all of these. And with these insights, the system can then drive into an action mode where clinicians or guardians or spouses or other people in the system can receive alerts highlighting the combined risk factors and suggesting next steps. The individual also will could receive real-time support through a chatbot and can share concerns privately, and get interventions and know that it's not all hopeless. And the chatbot can offer coping tools, reminders, and prompts to re-engage in care. And then caregivers are notified where applicable so that they can provide additional support at home. So all of these can now happen when you combine all of these together. And this example really demonstrates how AI can connect fragmented data and detect subtle warning signs, each of which might be harmless or may not be significant enough to trigger some action. But when you put all of these together, and you can deliver more actionable support to individuals, clinicians, and caregivers, and ultimately helping prevent these kind of crises. I'm also happy to share that at Backpack Healthcare, we've built all of these tools. We've, over the last year, or many of these tools, and over the last year, there were at least 25 cases where the technology really helped identify potential suicide or self-harm risk, and escalated that to clinicians, and also intervened through various digital tools and avenues, including a care companion chatbot, which is based on a large language model that is completely trained on mental health data, and it's built to be empathetic, and it's trained using a responsible AI framework, so it can never say something harmful or never ignore something that is concerning from the individual. So we have all of that is built and currently being used by our patients and our clinicians. And now that we've seen a hypothetical example, let's maybe step back a little bit and look at the future, or not really future, but current applications of mental health or AI in mental health. So the first one is supporting at-risk individuals. So AI can help monitor adolescents, in individuals with chronic conditions, and those in post-crisis recovery. And tools like real-time monitoring and follow-up support ensure that no one really falls through the cracks. And that is something that's already happening. Expanding, and the next part is expanding access to care. So for communities in rural or remote areas, we can offer 24/7 digital support through chatbots and tools that don't require immediate human intervention. So that way, it makes it really accessible to every individual in the country, and hopefully eventually globally, because not everything happens in between 9 to 5 on a day. And so additionally, AI can also kind of break down some of these barriers of languages and other cultural factors through to more inclusive care. For example, the Backpack Care Companion that I talked about, which is our chatbot, empathetic chatbot, it is available in over 200 languages. So it can really be used globally, and obviously differently in all languages in the US, but then globally as well. And the third is, it's not directly related to mental health and suicide, but we already talked about clinicians and the lack of clinicians or sufficient number of clinicians in the country as a big problem. And they are overburdened. So AI helps optimize a lot of their workflows through tools like automated progress notes, or resource allocation, or personalized treatment plans, et cetera, which help reduce the administrative burden that clinicians have, so they can focus more on patients, be more present with patients, and handle more patients, and reduce the overall care gap that we have in the country. Right. And the next one we'll talk about is enhancing early detection, right? So with AI-based screening and predictive analytics, we can identify early warning signs of mental health issues. Tools like personal coping strategies ensure that individuals receive more timely and tailored support. And lastly, empowering caregivers and clinicians. We can empower them with insights and tools to help make better decisions. And clinician augmentation, and especially those tools, administrative tools that we talked about, they reduce burnout by supporting their work. So they're not fully reliant just on themselves, and not just from a reduction of admin work, but also in clinical intervention. So they can support them, and we have some of these tools that are built today that we can support them in in delivering that better and higher quality of care in order to kind of prevent mental health issues and suicide specifically. So overall, I think these applications show how AI is not just about replacing human effort, it's really about enhancing it. And by supporting individuals and caregivers and improving clinical workflows, we can really create a mental health system that is proactive, that is efficient and more compassionate. And these are all current applications. And in Backpack itself, we have developed most of these interventions into our care model. For example, the care companion, the automated progress notes, personalized treatment plans for our clinicians, risk identification, and other various kinds of predictive analytics that assess various factors about a patient and highlight those risk factors. So they're all very powerful tools that can completely change the odds in the mental health crisis. But to realize that potential, we need to address the challenges of implementing AI responsibly and ensuring privacy and trust and fairness, etc. So what I kind of just look at some of these key factors and key challenges and how we can help overcome them. So one of the biggest issues that we face, especially as we're kind of building some of these tools in Backpack, the accuracy and misclassification is a huge issue. One of the biggest issues, because AI systems can sometimes produce false positives, or actually a lot of times, and flagging risks where none exist, which is annoying, and that causes a little bit of the alert fatigue. And then, or the worst problem is false negatives, where critical warning signs are missed with high-risk individuals, which what that could end in, right? So, and why these are such a big problem is clinicians, the caregivers may experience alert fatigue. That is one part of it. Too many unnecessary notifications can reduce attention to truly critical cases, and they learn to ignore these ones, which could be a problem. And it leads to unnecessary interventions, adding stress to patients or just cost to the whole system. For example, and if you look at AI misinterpreting someone's use of certain words in a journal entry. So if they say something around severe stress, it could mean just that that's a natural stress level, and you don't want to unnecessarily escalate that to crisis services and overwhelm the system and the individuals. And so I think that's the same thing with the false negatives as well, that you don't want to miss any of those warning signs by trying to over optimize. So it's really important to kind of strike that right balance, and there are various metrics and model metrics like precision and recall, etc., that help pick the right kind of model for the right purpose. And those are really important to do. And then there's also a problem of ambiguous user behavior or data that can further complicate the ability to interpret the intent more accurately. So, for example, if somebody shares something online like, I can't take this anymore, it sounds concerning, but it could also be just a venting about work frustrations, that's common language. So it's really important to know the context and the entire individual before you jump to react to a line like that, or for AI to react to a line like that. And without that nuanced understanding of these factors and the background understanding, it might flag it as a high risk, whereas other signals of concerns like withdrawal or physical changes could go unnoticed. So those are all problems. So it's really important to kind of know what is noise and what is signal, and to weed out the noise in order to make these determinations. The second key thing is challenge is data quality and availability. And obviously, AI is only as good as the data that it uses. So gaps in clinical, behavioral, or biometric data, such as underrepresentation of certain populations, that could limit the accuracy. Additionally, there could be underserved areas that often lack reliable data inputs, and all of that creates a significant equity gap. And tools that are created for one population demographic might not apply for another population demographics. You can't create one-size-fits-all tools. For example, the reason for suicides in Asian students could be very different than the reason for suicides in Black students. So it's very important to define the problem appropriately and then go about getting the right data and develop the right hypotheses for these microsegments to develop the right solutions. And of course, nothing is perfect, so you've got to test and refine and monitor and always use human judgment on top of any of these to ensure that we're mitigating against things like data drift or stale data and any kind of inaccuracies. Right. The second key problem is, or maybe another key problem, is the bias in AI data sets. And that's, I think there's been enough written about that, so I won't cover it in too much detail, but I'll maybe make a few key points related to the topic at hand. Because there's underrepresented groups, like data sets often lack sufficient data for certain populations, like ethnic minorities, rural communities, or lower social economic groups. There could be skewed data sources, like data that comes from a narrow range of sources, such as just urban clinics or specific age group that misses these warning signs in other populations and demographics. There could be historical bias, like past records, like diagnosis or interventions may reflect more systemic disparities in healthcare, and you cannot use that for a specific individual without other context. And then one of the other common ones is the labeling bias, which is incorrect or inconsistent labeling of societal behavior, and that can result in inaccurate model training, because ultimately what data you collect, what data you label, and what you train with, that will really guide your model. So it's really important to kind of ensure that bias is removed from every aspect of or every stage of the problem, all the way from problem definition to data collection to model labeling to model training, and then and how you kind of like implement the model, the way you implement the model. So those are really important. And the implication of bias in suicide prevention is that, bias can increase the likelihood of false negatives for such groups, like we already talked about, and that could be one of the key problems, right? So that's something that is really important to guard against. And some maybe just high level strategies to kind of avoid bias and suicide prevention. I think obviously you want to diversify data sources. You want to balance data representation using techniques like oversampling or weighting underrepresented data to balance the data set. So all of those are really important. And there's several techniques to kind of help do that. There's auditing and basically auditing and monitoring for that kind of bias. So regularly audit the AI models to perform across various demographics and ensure that there are sufficient fairness metrics to detect the disparities and address them systematically. So those are all really important ones. And maybe those are more from a technical point of view, but there are probably other process and organizational factors like having more transparent AI practices, ensuring that the AI outputs are explainable so that people who are applying these can understand how these predictions are made, and then they can validate them against the real world context. So without the explanation of why a prediction was made, it's very hard to know if that's the right one or not, if you don't know what data went into it. Another factor to avoid biases, or another strategy to avoid biases, to engage more multidisciplinary teams. So basically to collaborate with clinicians and behavioral health experts and community risk experts and all folks like yourself, research scientists, to ensure that all of these factors have been kind of like considered to create models that are unbiased. So I think that's one of the big issues. And I know there's a lot more on the topic of bias, but just in the interest of time, I'll move on to the next point, which is really dependence on AI. Because obviously AI is a powerful tool, but it must supplement and not replace human judgment. So over-reliance on AI, especially when done for a period of time, it can really lead clinicians to defer critical decisions, and can introduce risk, especially in high-stakes scenarios like suicide prevention. So if an AI model fails to detect subtle risk signals and clinicians just believe that and they defer entirely to its findings and use that to override their judgment, then an individual crisis might not receive the timely intervention. So that could be very dangerous. So it's unfortunately very common thing to happen, that clinicians would over rely on on AI or tools because they differ or suspend their judgment in favor of the tool's judgment. So it's really important to kind of train people to do that and to ensure that they're maintaining that independent perspective on top of AI. I think workflow integration is probably another key factor, and maybe somewhat mislabeled, but essentially the challenges can make it harder for AI to fit seamlessly into the whole care delivery process, because the mental health workflows are complex and involving multiple systems and stakeholders and data inputs, and it's over a period of time. It's not just one point in time, one interaction. So poor integration can slow the processes and create inefficiencies or lead to alerts being ignored. So, for example, if a tool is generating critical alerts for a high-risk individual, it must really connect to every single thing, including their social media, their electronic health records, to their telehealth platform, to their wearable data. And without all of that, it's really hard to kind of create a full comprehensive picture, and it adds more friction and noise than actual value. So that's really important. Another key factor or challenge that to overcome is the trust and acceptance. So how do you, because trust is foundational for AI adoption, because you can build the best tools, but if the people who are using it don't trust it and don't have the confidence in it, then it's really not useful. So how do you kind of build confidence among patients and caregivers? And to do that, really, you need to address all of these things around privacy and fairness and explainability. Because there's patient trust, so privacy and fairness concerns that the patient might have. They might worry about how the data is being used by AI, or if AI's ability to treat all populations is that valid or not, and how they might also worry about how their sensitive data is stored, because that's one key factor that we need a lot of this data from patients to be able to train it or even to provide timely interventions. So how is the data being stored, and is that safely stored and encrypted, and is there a promise to not misuse the data for other purposes beyond just the risk identification? I think those are really critical factors, and to build trust in the process. Similarly, clinicians and caregivers could also have this kind of skepticism. So they might be hesitant to trust AI recommendations, particularly if the reasoning is unclear. So it's really important to make those the explainability in place, so that then they can know why and how certain recommendations are being made, and how much to kind of give weightage to that versus their own judgment. And the last part in kind of building confidence is, like I said, I think it's somewhat referred to that is through explainability. And instead of just flagging a risk, it could highlight all of the contributing factors, like reducing physical ability, or reduce physical ability, or activity, or increase negative language, and so on. So all of those things, I think if it says that these are like 5 or 7 examples of what the individual has done, which is leading us to identify this, then there's a lot more weightage to that scenario and prediction. And lastly, ethical and regulatory hurdles, and obviously to ensure that there's compliance with laws like HIPAA in the US, or GPDR in Europe, and maintain the transparency in AI decision making, and safeguard the ethical use to prevent unintended consequences or misuse. And this last one is really important. So let's look at that maybe in a little bit more detail. Reason my slide seems to be stuck. There you go. Right. And the first one is, I think, data privacy and security. And given that we deal with a lot of sensitive information about the individual, and we're talking about like so much personal information that is required to make the right predictions. So it's really important to ensure that, one, at least basics are being maintained, like encryption, ensuring that all the data is secure at rest and in transit, and ensure that like all of the data that we're getting, there's also endpoint protection across each of these in the right way. Second is the access control, to ensure that only those who really need to access it are accessing it. So minimizing the access to only the people who are like the clinicians or care managers or trusted systems with legitimate reasons to interact with the data. I think that is really important. Also, role-based permissions ensure that therapists can access relevant patient records, but other stakeholders like let's say data scientists or admins, others can only work with anonymized versions of the data and not the actual data. And so that's really important to kind of maintain those things, and you have to build it up in the system. It's not something that you can add on as a layer later. So I think that's really important. And why it matters is because really I think that balance is needed for both personalized AI insights with the imperative of protecting individual identity. And then there are ethical concerns. Sorry, I think my slide is stuck for some reason. Okay, I think the second is the ethical concerns. So how do you, like ethics in AI really is about empowering users and ensuring that transparency and giving the patients autonomy to really control how their data. And sorry, I think it went too far. Right, my apologies. I think it was stuck for some reason. Right, and then I think from a data or more from an ethical concerns point of view, I think patient autonomy, transparency, I think informed consent is another important aspect that requires explaining the purpose of AI tools to patients and caregivers. For example, patients can choose opt-in tools to that predict the mental health risks. So that is really important. Then the third one, I think bias and fairness, we kind of spoke about it sufficiently, so I won't go into too much detail on that. But I think just maybe one point to highlight on that is just the equitable outcomes, ensuring that the predictions and the decisions are accurate for all populations. I think that's really important. I think the term equitable outcomes is really important to guide. And then I think the last thing we spoke about is the human oversight. And lastly, AI should really augment human efforts and not replace them. So something's wrong with the slides. Okay. All right. So I think I think those are maybe like 4 key factors from a privacy and ethical consideration point of view, which are also like challenges that need to be overcome when it comes to creating appropriate tools for suicide prevention. So I think earlier we talked about some of the tools that are currently being used. I want to take a moment to kind of talk about future possibilities in AI and suicide prevention. And it's not to say that all of these are not existing today. Many of these are there today, but I think just with there's a lot more work to be done in maturing some of these capabilities. Like predictive modeling is becoming more precise and identifying high-risk individuals using more improved algorithms. And a predictive model may detect heightened risk based on a combination of social withdrawal and increased use of negative language and so on. I think it's really important to kind of mature these models and to the point before a clinician might start to kind of trust these kind of models. Second, I think we always spoke about anomaly detection, how we can spot these subtle changes in behavioral markers. But to do that at scale, across all interactions with an individual and all data we have about an individual, I think that's really important. And I think a risk score is another one that we use a lot to identify at-risk individuals, and that needs to be somewhat dynamic, and it's not a static factor. It's something that can change very, very quickly. So something that happened today or yesterday over the last couple of weeks or so, if their app usage drops or their sleep becomes irregular and their journal indicates more negative thoughts, the AI can very quickly increase their risk scores to send a real-time alert. The results are somewhat, I mean, obviously there's a lot that needs to be done to kind of get that to the point where they're reliable and all-encompassing when it comes to the consideration of all the data that kind of goes into it. So those are maybe some of the key factors from a risk assessment point of view. Real-time monitoring is another factor. I think it's getting more and more sophisticated with more forms of real-time data, including sensor data or voice and speech analysis, various kinds of wearable data like rings or watches and other personal devices, all of those which can provide this kind of data and help more real-time monitoring. Expanding digital insights is another key area. I think it's been done across some other categories, like other industries, like finance, etc. And they're looking at a holistic picture of a person. I think it's really important to do that from a mental health and suicide prevention point of view. Then mining for distress signals. So how do you kind of look at all of these digital behaviors, analyze public social media posts and comments and interactions to identify signs of emotional distress or concerning behavior, and how you can do that in a more systemic, thorough manner. I think there is a lot more maturity that could come into this area to increase the level of accuracy in determining some of these factors. The fact that there's still so many suicides in the country just means that we're not doing a good enough job of mining for all of these factors across all categories. Obviously, some things around permissions and privacy and consent, all of those play into these factors because nobody wants to do that, or not many want to kind of give access to some of those information because they don't know how it's going to be used. The sentiment tracking and more real-time detection of emotional patterns, like looking at like face and language and tone and vocabulary, all of these are being done. There's a lot more maturity that can happen, especially when it comes to the voice and face detection. And these are tools that I think we, even at Backpacker, are working on to see how we develop models that can supplement other text and verbal messages and information with facial and voice data. So at some point of time, we can probably combine these to create better, more holistic representations of an individual. And last but not least, I think it's really the personalized and augmented care and more, and how do we integrate various forms of care and make those things possible, like AI, telehealth integration, Gen AI consent, etc., and ensure that all of these together are in a place which allows individuals to trust the system more and provide the right kind of information that will help us help them. And last but not least, it's the scaling of mental health support. So AI's scalability will really allow us to reach a lot more people in the country and more globally as well, especially underserved populations. So community-based tools like chatbots, etc., or for schools or clinics and rural areas, all of those are customized for specific communities and institutions. I think that really helps. And also language inclusivity that is powered by Gen AI and natural language processing. I think that can break down a lot of the language barriers and make it more accessible. And finally, I think, say, the global outreach will create more scalable frameworks to build and bring AI-driven solutions to mental health systems worldwide. So a lot of these, and there's a lot of work being done in these already. And I'm hoping that with all the work that you're doing and everybody else is doing in the country, I think we'll get there and make a significant dent in the crisis in the country.